Yamhill County Leadership Roundtable. Thank you again to Mayor Wytoski for getting us all the right links and moving us around as needed. There are a couple of things that I'd love to have us address this week, and then we'll get into the folks who need to timely say things and then leave. If we can address business relief programs, both at the federal and state level, as a check-in to see what businesses are experiencing now. Unemployment claims and the process for folks to go through, because there's been some confusion out there from the Department of Employment Department. Public health updates, the governor's press conference from this morning, and then federal updates. And I believe that Stacey from Merkley's office is going to give us a federal update. So to that end, Mayor Hill, I promised Mayor Hill he needs to get on another phone call that he could give an update first. What do you want to tell folks in McMinnville, Mayor Hill?
Again, thank you, Casey, and all those that are on the call. I'm going to be meeting at 1:30 with MEDP on my monthly meeting with John and Scott, just to get a sense of where we're feeling we need to focus in the coming weeks, and especially after the governor's conference call. It looks like things may be opening up a bit, cautiously going down that path. The thing that I'd like to share is that we continue to have the stable table, which would be representatives from the city and from MEDP, the chamber, and the downtown association meeting on at least, they've been meeting twice a week, once to twice a week, talking about recovery and how we can support businesses. As many know, we have a very diverse base, and so all the way from the steel mills to manufacturing that continue to employ and do the things they need to, but it's our downtown that have those unique shops that a lot of those are tourist oriented with food and beverage, and those are the ones that are hurt. So we're talking specifically how to get ready for when we move more to an open environment, how to engage people to be back and utilizing those resources. We're looking at finding grants that might allow us to participate in some sort of business help, but we're looking for grants where we can put a sum of money up and then double that or 1.5 times that, so that we'd have the kinds of funds to give real relief, along to understanding where we're headed with the stimulus, small business, and those types of things. So that's just a brief report. We continue to bring library books to families that would need that just by calling, prescription pickups for those that can't get to the pharmacy, and we're working very diligently on continuing to support the homeless through YCAP and through the county, and the meetings continuing from that perspective.
Great, thank you very much, Mayor Hill. Does anybody have questions for Mayor Hill before we move on to Representative Gomberg and Senator Roblan? Okay, great. And if anybody wants to take a crack at explaining to the public the 5 prerequisites for opening that the governor laid out this morning, I would love to have you do that. So without further ado, Representative Gomberg.
Thank you, Commissioner. Thank you, Mayors. Thank you to everybody that's listening. The 5 criteria, I'll let Senator Roblan outline each of those. But let's back up for a second and make sure it's clear to everybody. The legislature is not in session right now. We have not been called into special session yet, although we may be, which means that that we representatives and senators are in a position of negotiating rather than legislating, and that's an important distinction. And we are involved on a daily basis with briefings and presenting questions and talking to agency heads about a variety of different issues, concerns, and problems. I wanted to go back to the one that I'm hearing the most about, and that has to do with unemployment compensation. And I'm hearing from a lot of people who have submitted claims, and when they come back to file for the second week, they get error messages. There were reports in the media over the weekend that there was a glitch in the software that was telling people that they had to refile and start all over again. there were a variety of different challenges going on at the agency level. And on one hand, I have to say I kind of understand that they have had 250,000 claims in the last 3 weeks, which compares to maybe an average of 4,000 a week previously. They have quadrupled their staff and are adding more people, which is good news, but it also means that 3 out of 4 people working there and handling these claims has worked there for only a couple of weeks. And of course, the federal government also is changing the rules, which means we need to change the software. So it's a perfect storm for the agency, and I get that. But that's no consolation, that's no comfort to people that are getting error messages, that are waiting for checks, that are trying to phone in and get nothing but a busy signal. What we are being told is to urge people to email their questions rather than to telephone them in. That's very important because the emails are getting answered more quickly than the phone lines are, and of course you can email any time of day. So there is a special email address that's been set aside for questions about unemployment. I can pull it up and share it later if anybody needs that. For those that represent employers, the additional concern I'm hearing is that this spike in unemployment claims may affect your taxes, your rating, the amount that you pay into the trust fund in the future. And I know that a number of employers have received letters that look like bills. They are not bills. They are necessary reports that tell people the process. And the information I'm getting is that because your payment rate is based on about a 2-year period and broader standards, that this is not likely to affect the amount that you're paying in monthly taxes into the trust fund, and so don't need to be concerned that because you've had to lay people off that you're going to get a spike in the taxes that you're going to have to pay. If it goes up, it's going to be because everybody's gone up, not because you happen to be in a sector uniquely affected by all of this. So the good news is that there's every indication now that we are peaking and are going to be starting to see a decline in the number of positives, a decline in the number of hospitalizations, a decline in the number of fatalities. That's the good news. How long is it going to take for all of this to be over with? That's the question that we keep getting asked. The governor outlined some criteria that will help answer that question, and it had to do with the amount of personal protection equipment that we have. It has to do with social distancing. It has to do with a total of 5 different criteria. But at the end of the day, I think the answer is it has to do with us behaving responsibly. The more responsibly we act, the more likely this thing is going to be to decline rapidly. And if we get complacent, if we don't wear masks, if we don't wash our hands, if we don't observe social distancing, then we can look at this thing resurging. And that's the worst case scenario, is that we start all over again. So people need to take the good news as good news, but not as an excuse to act badly. And the sooner we can flatten this out completely, the sooner it's going to go away. I think that's the short answer. And I'd be happy to answer any questions about those issues. But I know that Senator Roblan's got some things to add as well. So I thank you for letting me go first today.
Sounds good. Thank you very much, Representative Gomberg. And Senator Roblan, please, I'd love to have you go next, but I want to get some order here too. So I'd love to have Councillor Yarnell, who also is part of operations at Providence Newberg, speak next after you to kind of give an on the ground up in the first couple stories of our hospitals in the area as the next point, and then go into mayors and commissioners. So thank you, Senator Roblan.
Sure. So my name is Elise. Now, is that me? Am I on?
Or did you want me on?
You know, let's, since Elise is on and she has a boy with her, does that work? Okay.
Sure. Always.
Lincoln is there, right?
Lincoln is here. Yeah, so I work for Providence in my day job, and I work at the Newberg Plaza, and I'm the senior manager of operations for outpatient services. And so what that has looked like in the midst of COVID-19 has been implementing a triage center for all of Oregon for outpatient services and standing up drive-through testing sites. We currently have 5 sites in Oregon, one of which is at Newberg Plaza. And so we're able to do drive-through testing after a virtual visit is completed. And the reason for that is really to be responsible around testing criteria, but then also limit exposure for patients and have a very scheduled approach at that. And so it's been going really well. I oversee Yamhill County area for outpatient for primary care and behavioral health, but my role extends to South Beaverton too. So I can just speak a little bit that, you know, from the medical perspective, I think people are exhausted just as other people are too. But you know, social distancing seems to be working, which is a really good sign. And I really echo what was just stated about continuing to be responsible. And one thing I did just want to say thank you. I think, you know, the outpouring of love and community support during this time around donations of PPE and food and all sorts of things has really been what I think for the medical community keeps people going and positive. And, you know, most people, I would say, really feel like this is some of the most important work of their career. I know I feel that way. And so the 14-hour days, you know, are absolutely worth it for the safety of our community. But I really just appreciate all the love and support that has been poured out from our community, specifically in Yamhill County. You know, there was a superheroes work here sign added at the Newberg Hospital, and, you know, people were actually crying when they came into work and saw that. I know that one went up at Willamette Valley and in front of the public health building. So I just want to extend my gratitude to all the public officials on this call, but then also to anyone listening to this call, just that, you know, my heart goes out to you, and I hope that everyone continues to stay safe during this time. And if you need support, don't hesitate to call your primary care office that can get you connected to a virtual care provider.
Great, thank you very much, Elise. Elise, I have 2 questions for you. How can the public continue to support medical providers and healthcare workers? And then how can the people arrayed here on the screen help you right now too?
Yeah, the public can help, I think, by continuing to stay home. I know that sounds trivial right now, but truly it is what's going to change this into a different direction. But then also, you know, the donations have been amazing of PPE. There's a standard process we have at Providence to accept PPE, so I'd be happy to facilitate any local business that's looking to donate PPE or homemade masks. I've taken 250 homemade masks that have been donated, and my staff love those. And then you know, continuing to encourage people to call in when they do have symptoms, I think is really important. I think we have seen some people stay at home and not call in and get advice on symptoms, even though there isn't treatment. There are ways that we can support symptom management and escalation to a higher level of care. So I think that's really important to remind community members about. And then from the elected officials on this call, I think, you know, we're looking, as is every health system, how we're going to come out of this financially. And I know no one wants to talk about that, and I don't want to talk about it. It's the devastating part of all this. But I think continuing to push for reimbursement of virtual care visits is huge. That's something that most insurers actually don't pay for right now. And I think that that's one of the silver linings in healthcare around lowering the total cost of care for community members is that we've been forced to care for people virtually, which I think is a really positive thing. A lot can be done via Zoom, as we're realizing right now, even on this call. So pressuring insurance companies to reimburse virtual care is a huge piece of that.
Great. Thank you very much, Elise. I have a question from Nicole with the News Register, and that is, how can people make use of the drive-through testing? And I know you touched on it briefly, but if you could provide a little bit more detail for Nicole.
Yeah. So for drive-through testing at Providence, there are two avenues. One is having, so if you're a Providence patient, you can access it through your primary care provider. If you're a symptomatic patient, if you're a non-Providence patient, you can visit www.providenceexpresscare.org, and that is our virtual team that is for any patient, regardless of system that they belong to, and that is how they get connected to be scheduled on the drive-through testing site.
Thank you very much, Elise. Other questions for Elise before we go on to Senator Roblan? Okay, great. Senator Roblan, do you want to be to have the honor, since you sent out a newsletter telling us about the press conference?
Yeah, I know. I haven't even looked at that yet, though. So what's the? Do you have the 5 in front of you? Because if you have them, I can tell you go through it.
I do.
Okay.
Should I hold them up?
No, just say 1 through 5.
Okay, 1 through 5.
Come on. What's number 1?
In no particular order is a dramatic reduction in cases, in active cases.
Okay.
Adequate personal protective equipment for all facilities, including businesses that might reopen that are not medical providers. Increased testing capacity, basically doubling the rate now. Safe quarantine for folks who don't have a place to quarantine. And comprehensive contract tracing.
You did a good job. I got them. I would be glad to go over those because we have talked about all of this for a long time.
And then one more thing. I'm sorry to interrupt you, but Commissioner Starrett also wanted to kind of bring up the discussion around geographic opening, and so maybe if you can address that as well, and we'll allow her to ask it and talk about it later.
Okay, be glad to do that. So,
sorry to interrupt.
No problem. That was great. On declining cases, if you look at the indicators, what's happening, you have noticed, I think, at least a leveling off of cases. So the number per day is pretty consistent lately. We want that to start its decline, and that means that people are really staying inside, and the cases coming up from the community aren't going to be showing up. So we know that this virus has a number of people who carry it but don't get sick. We know some others get sick but not very sick, and so those people, when they're in the community, have a chance to spread it. We want to make sure the spread is under control, and if you look at the data, it looks like Oregon has done a really good job of that, and Oregonians have done a good job. They've stayed away. So now what we don't want to have happen is we want to have a really good baseline of where those cases are, hopefully declining, and we need that to inform us if we open up that it doesn't start back up again, because if it starts back up again, we got to tamp it down very, very quickly, because we don't want it to get away like it did in New York, California, and Washington. So that's number 1. Figure out where that is, and that'll be a lot of epidemiologists and other people looking at the numbers and saying this is the time. Number 2, we have to get bigger supplies of PPE. If you watch the news lately, this couple back east figured out a way to sterilize the N95s in large numbers. So a lot of places are getting these big new facilities that are built by the federal government and shipped out to states, so you can actually reuse some of those 20 times over. That would help with the numbers. We have lots of orders in, millions of orders in. We aren't getting them at the rate we would like, so we need to have enough so that, one, our rural hospitals can start actually having elective surgery again, which is really important for their survival, and we can get dentist shop opened up again, and we can get all of those other medical, eye doctors, all of those people sent all their stuff in, and they don't have the equipment they need to get working. So that's why PPE is really important, and having enough of it to spread out. We added to the healthcare workers, those workers that are in care organizations, nursing homes, and those other kinds of stuff. They're getting shipments now at the same rate as doctors' offices are, because especially if they have a case in their particular facility. So we have to make sure that those healthcare workers are being protected as well. If we get enough of the PPE, then we can start doing things like opening up our rural hospitals, our clinics, all of those kinds of things. And then I think as the governor acknowledged, you can also maybe start opening up hair salons and barbershops. And I know Gomberg is really waiting for that one. So make sure that we have the opportunity to open up some of those businesses where having the personal equipment allows you to do your work. And we've also got to make sure that everybody in the state has their own mask. They don't have to be the surgical mask. They need to be cloth coverings so that they don't spread the disease if they aren't symptomatic, and everybody looking around sees everybody and feels safer. So you've got to build that into how we go forward. The next one is testing. Right now we're doing about 7,000 tests a week. We need to get up to 15,000 tests a week or more. As you know, we got some of these new fast tests. That would be really helpful because many of our tests take 2 or 3 days by the time you ship them off and get them back. That doesn't help us as much as it would be if I could give the test and 10 minutes later I knew if the person had it. So Curry County was one of the hospitals that got one of the new test machines with a few of the problem is not the machines. We've got 13 extras. It's the number of tests that they actually have. And hopefully Abbott will start producing those in much mass produced, and we'll have a lot more of those. So that would be helpful. As you know, there's also a group of people testing to find out if they can test a person to see if they've had it already and have an immunity. Those would be great tests to have. We need a lot of those to figure out who's really ready to go back to work and wouldn't have to have all the protective equipment, all of those other kinds of stuff. That's going to be a while. So, but testing is essential so that we can know if we have another case. Then comes the next one that she said, and that is, how do we know who they came in contact with? And as you have probably seen in the news, Google and Amazon and all these companies are coming together to try to figure out, Apple, to figure out whether they can make Androids and cell phones, when you get near each other and you spend 20 seconds actually face to face, it can identify that contact and keep it in your phone. And therefore, if someone comes in contact with a person that we know is sick, the phone will tell you who all those people were, so you could go and contact them. So that's that contact information, because the more we can track down where they got it from, the better we are to keep people safe. Next, we have to figure out a way to quarantine people. And that means all people, including homeless and other kinds of people who may not have a place, but when they end up being sick, as a safety precaution for all of us, we've got to have a place where they can be quarantined and taken care of. Most of them won't need hospitalization, but they need to be away from the rest of the public and not affecting anybody. And then I already talked about the fifth one, which was the ability to track where the people have come and gone. So those are the issues. If you look at what Germany has done, they have an incremental program of putting people back to work. If you look at some of these other countries that have already gone through it, it's working. Though you will find, I think South Korea is a little concerned because they may have gone back fast enough and they're seeing a little uptick again. So they're not sure. We don't know this virus. We don't know if it goes away in the summer, if it stays around forever. So that's another one of those big issues. And finally, we haven't really, it appears that if you've had it and you have antibodies, you won't get it again. We don't know that for certain yet, because there were anecdotal things that said people had gotten it a couple times. So testing is going on to make sure that's the case and what it takes to be there. So those are the things that have to be in place. Geographically, there are places like Coos County that haven't had a case yet. We had one in our in a jail facility down here who was there for over a month. So they assume he got it from someplace in the community. We just don't know how, because shortly after he got there, they closed all of those facilities to all visitors. So, and nobody else has shown any symptoms, guards or inmates. So they're still stymied about how he could have come in contact with this. But he's been moved out of the county back to a quarantined area in another facility. So, but there are a number of those counties around, especially in Eastern Oregon, that don't really haven't had any cases. Most of the counties are now 1, 2, and 3 cases, and we need to make sure that they, like the number one issue, that those cases aren't increasing. Because if they're increasing, then they had it in the community for a while before it started breaking out. And as you know, 2 weeks of time to start incubation to get to sick means that you could come in contact with a lot of people in those 2 weeks. And so you've got to figure out that the community isn't having spread before you want to start putting people back. Number 2, I think they really have found that simple face shields work really well for you keeping it to yourself and not spreading it. we need to make sure that that becomes the standard for people as they go out and wander around and do things. Because you still need to go to the grocery store, you still need to do some stuff. You also see grocery stores have already putting up the plexiglass guards between them and their people. You've got to get more of that in place so that there's less likelihood of transmission to those frontline people that have to come in contact with so many people. So those are some of the things that have to be done. I don't know when it will happen, but I will tell you that people in rural areas where we haven't seen any, where our hospitals are having a real difficult time and we don't have a lot of cases, it's kind of like they want to get back to work. They want to do some things. And I appreciate our governor in the sense that she didn't close down all of industry like both California and Washington went really hard on that. So we've had construction going for, we never closed it down. We've had pet shops grooming pets, and we've had grocery stores and other kinds of facilities open, and we haven't seen the spread continuing. So those are positive indications that if people are responsible, as Representative Gomberg said, and take care and recognize that they're not just protecting themselves, they're protecting their neighbors and their friends. If we do that responsibly, it looks like we may have an avenue at some point down the future. I don't know if May 1st is the deadline. That's the one that the president talks about, but I'm hopeful because Oregon has certainly not seen the surge, and we Oregonians have been really good. That's pretty much that one. Any other questions? And the geography thing, I guess I'll ask that more as she goes in, but I think what the governor is looking at there is where we know it's not in the community because there isn't any cases and it's not popping up one way or the other, and we've been over 2 and 3 weeks with the timeline. The problem is, and the reason that she got together with the other 2 states, and I know that they've had conversations with Idaho, they're a little bit behind us right now. There are big surges that are happening now, but the reason that she got along with the other 2 is that we found out that we didn't have any on the coast until spring break, and Seattle came to visit in Lincoln County and north, and that's when we started getting our first cases. So what we don't want to do, that's why we have closed our clamming, we've closed our hunting season for out-of-state people. We have control here and people are being responsible. We can't speak to the other places, and you open it up and all of a sudden become the recreational place for everybody on the West Coast. That would not be good for us because those people would come without the conditions that we have put on them, and that makes it nervous. So we do need to talk to them and make sure that as we do these openings, many of our people on the borders of Idaho, Washington, and California, their medical facilities are in the other state, back and forth. So we've got to figure out how to make sure all of those things work well, because the virus doesn't really care what state it's in.
Great, thank you very much, Senator. I wanted to provide Commissioner Starrett an opportunity to either add to the comments or to ask for clarification. Absolutely. So, great, Commissioner Starrett, are you available? Okay, well, we will come back to Commissioner Starrett. We have a number of mayors here as well, but I have a couple of specific questions for the economic development people in the room or in the room. So if you could be patient with me, Mayor Cape and Mayor Cooley, I'd love to hear from Shannon, Buckmaster, and Gioia about what they would like to tell business community members, but also how they can explain to a manufacturer who's looking to produce personal protective equipment or testing, what do they do and who do they talk to? And thank you for joining us.
Yeah. Shannon Buckmaster with the Chehalem Valley Chamber of Commerce. I can start off, and there are a couple other questions that I wanted to address. So first of all, applications are still open for the EIDL loans, which are the emergency disaster loans through SBA. It was part of the second stimulus package. And we have the CARES Act loans that are still out as well. There's some confusion with the EIDL loans because originally they came out, it's not a forgivable grant, it really is a business loan, and I do want to emphasize these are business loans. This is not free money from the SBA. But at some point a provision was added to the EIDL loan that when you apply and you're approved for the SBA's program, then you also received a $10,000 relief grant. It was forgiven $10,000 right there. After that detail was added and released and was well marketed, we had several people apply and they weren't awarded $10,000. There was a change that was made by the SBA It was not connected to the federal decision for the second stimulus package, but they reduced that $10,000 grant to $1,000 per employee up to $10,000. So especially for our small businesses who were seeking the EIDL grant or the EIDL loans specifically for that $10,000 in relief funding, we're all disappointed. We didn't send out incorrect information. The information changed. So we also, it's important to both of our chambers and all of our economic development partners to say that we work hard on being credible sources of accurate information. We're trying to stay informed. We're adjusting to these changes, but we want to maintain our integrity with the business community as we react with you to these changes that we don't see coming. So with that as well, a lot of confusion still in accessing the payroll protection plan funds, and these can convert to forgivable loans. Again, remember, this is still a loan to begin with, so you have to be prepared that if you don't return to pre-COVID-19 workforce, you're responsible for repaying those funds. And so we don't want to add insult to injury for our businesses who are expecting one outcome and find themselves in a financially more difficult situation. The PPP programs, so payroll, they are only available through banks. So the oh, sorry, I cut my finger pretty badly. So point your finger, a little stubby lately. So the SBA EIDL loans, you go directly to SBA's website and apply for those online. For the PPP loans, which can convert to forgivable loans, you have to go through an authorized banking institution. And Gioia and I of both chambers are keeping tracks on what businesses are doing that throughout Yamhill County. There are 3 businesses that have opened up applications to non-banking members, which is a big issue for people. Either they weren't banking at an institution that was approved as a 7A lender, or they didn't have business accounts at an organization that was approved as a 7A lender. There are options. I do know that First Community Credit Union in Newberg, Heritage Bank, and US Bank are open to serving non-members. It's my understanding you still will have to open a business account in order to apply for PPP funds, and they simply are prioritizing their members. Remember, they are businesses too. It has to make sense for everybody in order for us to build this program in a financially sound manner. So I wanted to comment on those. And then I was also going to mention the Oregon Economic Development Association, OEDA, is actively working right now on a statewide economic recovery plan. And one of the challenges, especially for our very rural county, is that we're often overshadowed by the needs of the Portland metro community. So OEDA is specifically reaching out to rural economic development partners to make sure that they're creating programs that assess our particularly rural needs. And then finally, for manufacturers who want to transition to production of PPEs, I thoroughly recommend reaching out to Avishta Stone at Sedcor. They're doing an excellent job running all of those programs. In connection to that, though, there are grants available for companies who want to do this. OMEP just released a grant. The information is on their website. The state has a survey registry for suppliers. You can connect Avishta to find more information about who's doing what and who's trying to transition. And then Safe Corporation just announced refunding, not refunding like taking the money back, but adding more funding to their grant program for safe workspace development. It's $15 million in funding, and it's open now. Any questions?
Questions for Shannon?
I've got a quick question, if I may. We're hearing about all these resources that are available for small businesses, but I'm also hearing increasingly that it's the large small businesses that the money is going to, not the smaller small businesses. And of course, I'm sure Stacey will confirm at the federal level, small means 500 employees. And we're not seeing companies with 5 to 10 employees getting the benefits that they may need more than some of the big folks. Is that what you're seeing here at the local level?
So what I'm hearing from our businesses is that they're all applying. The SBA does restrict these funding opportunities for between 3 and 500 employees. So we're missing the super small businesses, but restaurants, up to manufacturing, a lot of different businesses are accessing these funds at every employee size. There we go.
Can I jump in real quick?
Yes, please, Stacey.
Yeah, so that is one of the things that Senators Merkley and Wyden are really concerned about is like what you said, the bigger small businesses tend to be faring better because they have more clout with the banks. So part of what the senators are doing as we're trying to add more money to the PPE program is try to address some of those shortcomings so far. Like we're looking for a carve out for the smaller small businesses to make sure that they're getting access to those loans as well. So that's something that we're trying to figure out right now. We also have a list on the senator's website of banks who are currently lending to new customers and existing customers on our Merkley Main Street page.
Great, thank you.
I do also want to commend our elected officials. They are listening to our input and the needs of our business community. So as even if you look at the change between the EIDL loan and the CARES Act, we were able to add gig workers, sole proprietors, and independent contractors to some of these funding options. So I have heard, and I'm sure that we'll hear more information about how we can better serve the very small of the business. But I really do want to say thank you to Senator Merkley, his office, Senator Wyden, and Congresswoman Bonamici for how they've been responsible at the federal level, bringing that funding to fill in the gaps in our business community.
Yeah, thank you very much, Shannon, and way to shout out to the congressional delegation.
They're listening. Thank you.
Yeah, they really are. Yeah, and thank you, Stacey, Fritz, Al. Gioia, what can you add, and what would you like to tell business leaders and community members on top of what Shannon has said?
Mute. There we go. Okay. Hey, everybody. Good to see you all. Thank you for this call again today. I echo what Shannon said about our legislators and honestly, our government. Everybody's listening and really coming together to work on this problem. And it's unprecedented, and I love seeing it. So it's really cool. I don't know if you've noticed, but there are businesses who are actually changing the way they do business. So, for example, Yola Crest Cattle Company, they are partnering with other businesses, particularly those that were in the farmers market, and so they're selling fresh produce along with their meats. So they're working together to do business differently. I did go out there the other day, and we all stood outside. There were several people waiting to buy some meat, so that was really good. The chamber is partnering with MDA. The National Downtown Association created this survey, and MDA sent it out to their members, and they asked us if we wanted to use it. And so we're collecting data not just from downtown, but also from our entire community, and that's going to help us figure out how we move forward and what kinds of things our businesses need. And we can have the conversation on a phone with someone, but a survey is a really good method to grab a lot of information. So we're working on that right now. Regarding how to get PPE to the hospitals if they are manufacturers. So one of the things that's happening is, and I'll talk briefly, Commissioner Kulla, and Commissioner Olson and Commissioner Starrett, thank you so much for approving that grant. So there's a grant opportunity of $2,500 for manufacturers, and if they want to retool to work on a bunch of different projects, but one of them would be PPE. Is that correct? I understood that correctly. And so we're hoping to have this sometime next week, and then we can go from there. And it's a lottery process. And more on that when it's ready, but that's sort of that question. Certainly if businesses are interested in manufacturing PPE, I would imagine there's somebody to talk to at the state, and I'm not really sure, Commissioner Kulla, if you know who that is, but you could tell us who that is, because I'm not really sure. So I'll leave that up to you. Banks, US Bank, Key Bank, and On Point are the banks in our community right now that are taking applications for the SBA PPP loan, and they are working with their current clients, but they will accept new clients. They're large enough banks that they can do that. I think the smaller banks hit their limits, and so that's why a lot of people were left out. But there's other opportunities. McMinnville Economic Development Organizations, MDA, the Chamber, MEDP, the city, and Visit McMinnville are all looking at a grant program. We're working together to see how we can help our businesses in our community to provide some kind of assistance and where we're going to be moving down the road. I sat in on a call yesterday with the U.S. Chamber, which I will send to all of you because it was so fascinating. It was an epidemiologist, and he basically told us some really interesting things. For example, large gatherings could be limited due to unknown whether the COVID virus actually dies or will still be around. 14% of the public have been infected, they think, but we would need to have 50% if we were going to have herd immunity. So things like sporting events and other things probably would be difficult over the summer. And he said, of course, we all know this, one person that transmits the disease at a large gathering could overwhelm the medical system. So I will send that to you. He also said we may have to enact multiple iterations of social distancing to just, keep people from getting it, and any community that hasn't gotten it yet to be prepared for when it does happen. So that's all that good news that I have to share. Thank you.
Great, thank you very much, Gioia. And Shannon Buckmaster was kind enough to let us know that the Yamhill County grants, the open period is the 20th to the 23rd. It seems short, but we're anticipating that there will be a lot of interest in it. And the reason why they're doing a lottery process is that when other communities have opened this up, the very first people to hear about it swarmed the system and flooded out all the others. In some cases, hundreds of applications for 40 positions. In this case, we're doing 100 $2,500 grants, and the eligibility requirements are listed. So yes, right. And if you received a small grant from a city, you won't be eligible for the county grants. But yes, you can use those for retooling to produce PPE, but you can also use them to pay, a bill that's coming due. I also like to note that along those lines of what's open and what's not, Senator Roblan, I thought, did a really good job of talking about the flexibility that our state government has allowed people with the not designating things as closed and not closed, but here's what you have to do. And I learned from the state that there's a nice simple survey that if you are wondering, I closed my business, but I want to open it back up, what can I do? There's a survey, and you go point by point and you answer the questions, and that'll tell you whether you have to stay closed or whether you can open and what you can do in order to be compliant with the rules once you're open. So I thought that was really helpful. It allowed a business in downtown McMinnville to open back up with limited service where they closed because they thought they were mandated to close. So that's really exciting. Okay, thank you very much for your patience.
Casey,
Mayor, do you know if Commissioner Starrett is able to talk?
I believe she's working on getting that audio connected. We've been troubleshooting for several minutes and putting her in a couple different ways. So,
Okay.
Commissioner Starrett, are you there?
Okay, while you continue, just give me the heads up.
Commissioner Kulla,
Yes.
Commissioner Kulla, before we get around to all the mayors and Commissioner Starrett, I have I sent Representative Gomberg a text, but I'll go ahead and I'll read it, and I'll let him or Senator Roblan or either both of them enter it. Last week I was emailed Senator Boquist, and I'm in touch with Senator Boquist about staffing and employment vision. One time I was really amazed for putting all these people in, but I was very frustrated at the same time. To add those 300 to 400 employees is a very expensive proposition. I mean, more locations, more telephone lines, more computers, you name it. It's very expensive location. But at the same time, I asked Senator Boquist, I said, have they considered, because a lot of people get, calls that says, well, you're 90th in queue, or we'll call you back, and they never get back, that why the employment division hasn't consider taking some of those new employees and putting them like a 2 p.m. to p.m. shift when a lot of the people could make that call much easier, and at least open it up for a Saturday hours for longer, maybe to 10 p.m. And because it seems like they're great, but they're so if either Senator Roblan or Representative Gomberg want to answer that, that'd be great.
Well, to begin with, Commissioner, my understanding is that we do have Saturday hours now, and we are adding additional shifts. I don't know that they have made adjustments to their telephone system that would take messages and provide that you're 90th in line, or that leave a message and we'll call you back when it's your turn. I think the other point is that that we are taking a lot of state employees that have been furloughed in other positions and shifting them into the employment work, not just picking up new employees while leaving other people idle. So that's an important part of the mix as well. I think there are horrible challenges at the employment division right now with this enormous increase in demand. The average previously was about 4,000 claims a week, and now we're doing 100,000 claims a week, which is has brought about the necessity of bringing these new people online. What I'm hearing is that we are cutting checks. I'm hearing that we're also cutting the additional stimulus checks of $600 a week. And I'm also hearing that people are getting those stimulus dollars from the federal government, those $1,200 checks, if they are have a bank account on file with the IRS. That's not directly related to unemployment, but it's part of the income package that people are looking at during this very difficult time. So there's a lot of things going on there, and not without glitches. So I would say that we're very aware of the problems at the employment division. We're doing our best to move them in a constructive direction, and also trying very hard to help out the people that are waiting anxiously for support, because there's people out there that are hurting. They're worried about how they pay their bills, buy their food, take care of their kids, and that's got to be the priority. Arnie, do you have anything to add to that?
Not really much to add. I do know that it took them not very long to recognize they had to do Saturdays. I agree with the request. I think they could open up longer on Saturdays. They've got to come to that conclusion as they get the people in order. And the evening things, I know they extended some of the daytime, but they probably need to do more. Boquist and I have both been talking. I'm happy that he's reaching out to his constituents. I know he is, because we spend time on the phone and also on emails back and forth, trying to figure that out. The biggest issue here is there was never anything like this, and figuring out how to make it work has really been hard. The systems that the federal government relies on, and the same as our state and so many others, is really antiquated. And when you're talking about the kinds of stuff that they're doing, trying to get people to work, we have had fewer actual breakdowns in the system than many of the other states, but it still is a problem. And for those individuals in that first round that went in, they've taken the brunt of it because they've lost their information. They've had to do it a couple different times. I appreciate the people reaching out to all of the legislators, and the more that we call, I know that Representative Post was on a couple of times ago and said that when he emailed, sometimes they got back. We've been trying to do the same kinds of things to help our constituents, and I know David has done the same. So we will keep in touch. We'll keep trying to figure out what we can do. I know it's one of the highest priorities on just about every legislator's table, because that's the calls we're getting. And we know how serious it is for people who live paycheck to paycheck, and with no paycheck, it's really difficult. So we will continue to encourage them to extend the days as they get more people. That would mean that it wouldn't have to have another phone line, just keep that same phone line. It would also mean they could share computers. So anything we can do to make it more efficient, we will try to encourage. But I think they've been doing an amazing job given the circumstances they found themselves in.
Yeah. Great. Thank you, gentlemen.
Before, Mayor, are we successful in getting, okay. I've asked Commissioner Starrett if there's anything she would like me to relay to the group and to the general public, and so I'm just waiting for that reply. But
Just said I was unmuted. Can you hear me?
Oh, we did it!
Oh my gosh! I have two
Welcome.
photos. All right, thanks a lot for trying, Mayor and Commissioner. Just real quick, I wanted to go back, and I'll just take 10 seconds to say I want to go back to that geographic component of the governor's press conference today. And what I'd like to do is really just encourage our legislators, which I'm going to ask the board to perhaps take a look at this week, to take a look at the various counties that don't have any Cape, William, Baker, Jefferson Lake, and the ones that just have a few, like Yamhill, Coos, Crook, Lincoln, and Grand, and say that we not be lumped into the one-size-fits-all model. And so if the governor would see fit to release some of those restrictions for the counties that perhaps have a certain benchmark. So just something for us to think about and maybe pursue it from that angle.
So this is Senator Roblan, I agree with that, and I think that as she tries to roll out which groups go next and so on and so forth, they would be the great place to plan that, to see what happens. We'd have to watch real carefully to make sure we don't see an increase or any new ones, but I think they are great places to begin the process because there hasn't been community spread to this point, and as long as we can keep it out, the thing you don't want to do is, for example, what happened up in the North Coast is they had nothing, and they were open beaches and open parks and open everything, and everybody came. So we don't want to encourage people to come in, but those local businesses that are really serving the public in their areas make sense. So I think we should have that conversation. I will certainly pass that on.
Now, the only thing that I can add to that is that in many cases, the decision to close lodging, to close hotels, vacation rentals, or campgrounds is not being made by the state. It's being made by counties and cities. And so that factors into this as well. And yes, we have areas where there is a very low level of positives, and that's good news. We are all, believe me, very anxious to open up as soon as it is safe to do so. But part of the problem with opening up in different geographic areas is that it creates a magnet. If that area is open, let's go there and visit. Let's go there and shop. Let's go there and recreate. And that means the risk of bringing infections into areas where they haven't been prevalent in the past. So I think this is positive news. I'm supportive of a geographic approach, but I think we have to be very careful when we do it.
Right. Thank you. I think those are really good additions to the conversation. When I was watching the press conference, I did appreciate that the governor mentioned geographic, but also talking about how the rapid testing will be an important part of that, and the ability to do the comprehensive contact tracing for anybody who does show up with a test. So we definitely need those in rural areas if we're going to have people out and about in those rural areas, right? Commissioner Starrett, did you have anything more you'd like to add now that we got you on?
No, thank you so much. I appreciate it.
Okay, thank you very much, Commissioner. Mayor Cooley from Sheridan, what would you like to tell your constituents? And thank you for your patience.
Well, first of all, I'd like to thank Senator Roblan for explaining those 5 benchmarks. I was particularly interested to hear how they were doing the contact tracing. That's very interesting. I just like to thank our communities and our county for continuing to practice social distancing so we can keep these numbers at bay. And I appreciated the governor's remarks today to make sure that we don't end up right back in this situation again. So it's a fine line to walk, and she has some very difficult decisions to make, and just want to keep this going so that we can get everything back open in a reasonable amount of time. So I'd just like to say thank you to everyone.
Great, thank you very much. And it's nice to have your city manager back.
Oh, it definitely is nice to have Frank back. He's working every day. He's doing really well. So it was a blessing to make sure that he and Rhoda got back safely and weren't a statistic in this virus.
Absolutely, absolutely. Mayor Kate from Amity, what would you like to tell your community and tell the people arrayed here today?
Yeah, I think the one thing I want to say is I don't know if people heard about it, but there's a lot of Easter celebrations that usually go along, and one of the traditions here in Amity is our Firefighters Association and auxiliary group, they put on an Easter egg hunt every year in our city park, and obviously they knew they weren't going to be able to do that in their traditional way this year, and they advertised that they would go to up to 40 different houses in town and do a Easter egg uh, hunt, set it up at people's houses so that the kids could do that, and they wore the gloves and sanitized the eggs and everything like that, and it was just a really great thing to see, all the people posting the pictures of their kids getting to do some semblance of a normal Easter celebration at their house, and still keep the social distancing and do all those kind of things. So it was just a real nice story. I don't know how many people heard about what they were doing, but it made me feel good about our town and how we're moving forward with stuff. So.
Great, thank you very much, Mayor. Mayor Wytoski, what would you like to add? And thank you for all of your behind-the-scenes magic right now.
Technology, the challenges and the joys. Well, Mayor Cape, you're in a much better looking shirt today, so I want to first appreciate that. No more of that toxic OSU garbage on my screen, so that's great.
You see,
also, I definitely, oh, dang it!
And on the roof of my office at work, too.
Terrible, terrible. Okay. Well, I will tell you, it says I'm having connectivity issues again. Can you hear me still? Okay. I heard about what was happening in Amity, and I got guilted real bad by my family, who are my very toughest constituents, who were really upset that I hadn't figured out a way to do egg hunts. And my mom came up with 3 or 4 ideas like 4 days before Easter, and I simply couldn't take anything else on. So I'm actually pretty upset. I don't like being one-upped, but I wasn't able to pull that off. So I think that's really incredible that Amity was able to bring a little bit of normalcy and tradition and celebration to the community. I think that's really needed right now. In schools, we're really focusing on social emotional health, mental health, and making sure that we're providing that for our kids first. And I think we need to remember, of course, that extends to the rest of our constituents and not just our kiddos. To that end, yesterday, we did have a kind of mobile community concert. We had a local band volunteer. They got set up in clean suits, 6 feet apart on a very large trailer, and they just rolled through town, playing some great tunes. They did awesome. People loved it, but also people really respected, not to follow the trailer. You really wanted to hear the end of the song, but people for the most part stayed where they needed to. And we got a lot of really positive feedback on it. It was a really, really good thing. It was sort of like one of our summer concerts, a little taste of normalcy, very similarly. One thing I really want to tell my community, and actually communities across the state, is, not to forget about like all the losses here. There's human losses, and there's economic losses, and there's just experience losses. And one thing, I teach just seniors, so I live in this really weird little bubble at school, and my seniors some of them are really just happy to be done, and they otherwise were really doubtful they were going to pass my economics class, so that's there. But a lot of them also are just mourning, not getting a senior prom, not getting their end of year stuff, their skip trip, their awards night. We sign in concrete. We have all these great traditions, and they do a walkthrough where they go high five and hug all their grade school teachers. That's obviously not happening. And so I want to tell everybody, it's okay to mourn what we're losing in this. It's okay to grieve that and express what we need to and reach out for resources if necessary, and really try to lift them. I have been working, I don't know if I want to share all the details, but I came up with a really good plan for graduation that I'm working through for Dayton. And, I really hope it's going to celebrate our kids and give them just a really awesome opportunity to feel congratulated and really supported by their families, and keep that family connection involved, which I think is missing in most of the graduation alternatives that are being considered. And I really, really encourage people to start thinking about creative ways to do that for whether it's seniors, 8th grade, 5th grade promotion, whatever that looks like in your school districts. And just really give people any of that taste of normalcy, whether it's an Easter egg hunt or a band rolling through town or some semblance of a graduation. And if I can, kind of the last thing that I'd like to share is actually, it's just a Facebook post that I had. But it just kind of talks about my focus and my communication with my community at this point. Because we don't have a lot of widespread infection in Yamhill County. It's been very largely contained, and but the devastation isn't. The devastation isn't contained. Lots of businesses are shut down, and even the ones that aren't are operating with maybe 40% of their expected revenue. That affects personal households. So here's my message. At this point, what I really want to focus on is hope. And I hope that things actually don't go right back to normal. I really hope that we don't miss the lessons that are right here in front of us to learn. I hope we're better prepared next time. I hope we can see how important connection is for economic, community, and social emotional health. I hope that when businesses reopen, that we're able to create a boom for them. I hope that we rush to support local establishments with our food, clothing, plant, gift, and entertainment purchases. I hope as incomes are restored that we improve our homes and yards and support local laborers with our projects. I hope that we buy makeup and food and artwork and Tupperware from all of our friends running home businesses. I hope we really appreciate our time together. I hope we occupy our parks, our trails, our beaches, our restaurants, and our churches. I hope we greet our neighbors. I hope we shake hands, high five, and I'll warn you all now, I'm a hugger. I'm going to hug everybody. I'm going to hug longer and harder. And I really hope that we work to build improved connections between our cities, around our county, and within our own families. I hope that we honor those lost and the helpers who put their own health and safety on the line for us. And I hope we leave this world a little bit better. And I think all of that really starts with local leadership, state leadership, these types of conversations. And a quote from my dad, I hope we lead on.
Thank you, Mayor. Yeah, I was speaking with my father, and my niece, he's very close to my niece, and she was getting ready to graduate this year, and said they're spending a lot of time playing catch because she's a very, very, very skilled softball player. And he said, that's all I can do right now is just play catch with her. They chose to share a microbiome so that they could be together. Yeah. So let me know when you have your plans and they're publicly available so I can share them with my family. Okay, thank you. Who are incidentally in Gomberg and Roblan districts as well. Okay, thank you very much. Stacey, thank you for your patience. And what can you tell us from the federal level for the community and for the people arrayed here?
Oh, okay, I have to get myself back together after that. Thank you, Beth. That was beautiful. Yeah, so our updates, we're still trying to figure out the PPP and the EIDL programs. So we're kind of doing more of the same. The senators are continuing to try to fix that rollout, make sure that small businesses can actually access the programs. He and Wyden wrote a detailed letter to the SBA and Senate leadership demanding solutions to some specific problems that we've heard from the economic development groups and chambers and small businesses directly. I'm sure everyone has heard that there's going to be more money funneled into the program. We're looking at $250 billion. There's a little bit of disagreement about whether there needs to be more guidelines that go in along with that. So Senator Merkley is pushing for, yes, we want the $250 billion, but we also want to make sure that there are some guardrails in place that ensure smaller businesses, mom and pop businesses, minority-owned businesses that might not have extensive borrowing histories with banks, that they actually get that money too. And we're also advocating to make sure that farmers and ranchers can access the SBA programs. We have a portal up on our Main Street page. So if small businesses are struggling to get those PPP or EIDL loans, they can submit their information online, and our team is trying to help. We're a small team, so we're triaging as fast as we can and trying to troubleshoot where we can. But we would encourage folks to submit those online, and we can try to help out. Stimulus checks have started to go out this week.
The IRS has a portal up for non-filers to provide their direct deposit information. And then if you receive Social Security, retirement, disability, or survivor's benefits, or railroad retirement or survivor's benefits, you do not need to do anything to receive your benefit. Those will go out automatically. And then, like I said, there's negotiations happening right now over how to pump up and improve some of the emergency funding in the CARES Act. There's just a mass need for more small business rescue money, state, local, and tribal stabilization funding, healthcare emergency funding, and increases to food stamp benefits. We know that the federal response has been too little, too late. We're trying to get these resources out to people this week before it's too late again. We're looking at a more extensive COVID-4 package that'll come after we figure out the fixes to the COVID-3 package. But the senator is pushing on expanding and improving the small business programs, a moratorium on utility shutoffs nationally, a plan for federal leadership on widespread testing and contact tracing so we can get back to some sense of normalcy, as Senator Roblan and Representative Gomberg referred to. We're trying to get $2 billion for vote by mail so nobody faces potential life or death choice to exercise their right to vote. And then we want to get more money and more flexible money for state, local, and tribal governments to help pay for essential services, and so you don't get cut right where you need the money the most. And that's my update.
Great, thank you very much, Stacey. Do folks have questions for Stacey? Okay, well, thank you very much. Any last comments? And did I forget anybody? Okay, great. Oh, yes, Commissioner.
Yeah, I'd just like to thank everybody for attending these. I know when they were first put together by yourself and Mayor Wytoski, you know, this is probably one of the better ones I've ever been on, is because we have local elected officials, we have state elected officials, sometimes we have federal elected officials or their representatives such as Stacey, we have businessmen, we have the media. And so everybody's getting the same word of what's really happening at the local level, and hopefully people are learning that. I'd just like to congratulate everybody for attending and for you two for putting this together.
Thank you very much, Commissioner. Yes, thank you very much. And I want to remind folks in the audience, the people who are arrayed here work for you in so many areas of life. They are here for you. Reach out to them and I can connect you with them as needed as well. But thank you very much. The one thing I might add is that I need to get somebody from the tribe here. So that's on me. I'll work on that. All right. Thank you, senators and representatives and mayors and commissioners and business leaders. And till next time, I'll see you on Friday.